Welcome, everybody. We can go ahead and get started, and we can let people log on if they're just running a few minutes late, but I do want to respect everybody's time. So thank you guys for all being here. I am recording this just so that we can share it with people who couldn't make it today. And then I'll be able to share it with you guys as well. I did want to let you guys know you will be receiving a certificate of attendance for being here today. CCU is still working on being able to offer continuing education credits, so we are not offering those for this, but you will get a certificate of attendance for the training. So I will be sending those out later today or later this week sometime. But we can go ahead and jump in and get started. I will introduce you guys to our teacher today. So we have Dr. Andreas with us, and he is a full-time online faculty member here at CCU. As my email said, he is also a licensed professional counselor and certified substance abuse counselor in the state of Virginia and a nationally certified counselor. He's worked in the mental health field since 2005, and he's recognized for his work within inpatient and outpatient levels of care with individuals struggling to recover from addiction and trauma, and has worked with children, adolescents, adults in addiction, or in addition to couples and families. So he is going to be speaking to you guys today, and so I'm going to give it over to him, and then I'm going to stay on the call and watch the chat box. So if you guys have questions you want to put in there, you can, and then I think he's going to also open it up for some questions at the end. And I'm going to go ahead and keep everybody muted for now, and then I think he'll let us know if he wants you guys to unmute for questions.
Sounds great. Thank you so much, Jessica. I hope everybody can see my screen as I am activating my presentation for today. I see Jessica nodding here, so that tells me that the screen is live and active, which is wonderful. Okay, well, first of all, welcome everybody. My name is Dr. Andreas Bienert. As Jessica mentioned, I am a licensed professional counselor as well as counselor educator, full-time faculty member at Colorado Christian University, specifically teaching within the online program located in the beautiful state of Virginia. I'm currently residing in the quaint little town of Williamsburg, where the USA was started, as I hear and have learned. And yeah, it's an honor to be here with you today. And I'm excited to share some hopefully relevant as well as helpful information with you in regards to the theory and practice of counselor supervision. Although, thank you, Jessica, for the wonderful introduction. Yes, my clinical background specifically is within the field of addiction studies and addiction medicine specifically. However, as passionate as I am about addiction, that's not what we're going to talk about from a clinical perspective today. We're going to keep it within the realm of counselor education and supervision specifically, as I would hope for the next hour for you to provide you with basically just more helpful information in regard to how you can assist our students best, how you can grow within your own role as a counselor supervisor specifically, and perhaps to some emphasis and further training on your behalf as well. All right, some objectives for today's training. Basically, we'll talk about a little bit the definition of supervision, some supervision best practices, some supervision models, and then also integrating and identifying some ethical guidelines pertaining to supervision as well. I'll also say that I don't know where everybody comes from as far as your own backgrounds and your own trainings is concerned. Some of this might already be familiar to you. So from that perspective, I would also like to make this somewhat informal so that you can ask questions, so you can get some feedback if you have particular questions in regards to some of the field experiences that you currently do have with your work with our students. We will certainly leave some time at the end for discussion and questions as well, so that we can dive into a little bit of more of a process focus in regards to this training today as well, from a supervision type perspective. Okay, as already mentioned, just welcome and thank you so much for taking the time off working with our students at Colorado Christian University. We certainly don't take your time and your efforts for granted and are just truly appreciative and thankful for the work that you're putting in on a weekly basis in guiding our students within their clinical training. Okay, well, as we get this ball rolling today, I would like to ask you and encourage you to think back a little bit in regards to reflecting on your own supervisory experiences, and just within your mind answer the following questions. As a beginning counselor, what supervisory experiences do you think have helped you the most? What supervision experiences have you had that were at least helpful? What do you do at this time that is the same of the supervision that you have received in the past? And what do you do that is different from the supervision that you have received in the past? As well as, have you had supervisors who have treated you differently at different phases of your professional development? As I'm asking you to basically dive into those areas of your life and bring up some memories, I can't help but reflect upon my own memories and experiences as a counselor and training. And I will say, you know what, I've had both experiences. I've had good experiences as well as negative experiences in regards to my supervision that I've received, not just within my graduate studies, but then also within my my postgraduate residency hours in pursuing licensure here in the state of Virginia. Ironically, I found myself in my doctoral program as well, and I've taken counselor education and supervision courses already as I've found myself within postgraduate residency experiences. And at beginning phases had a licensure supervisor who I don't think was as well versed within the practices of supervision, and oftentimes would question, you know, what is it that she's doing with me specifically? I think she should be doing it otherwise, and so forth and so on, and would kind of give myself supervision as I wasn't too satisfied with the supervision that I've received. But then also looking back at my graduate level supervision, where I completed internships at a psychological practice, specifically under the leadership of a clinical psychologist who had licensed professional counselors on his staff as well, and have received both supervision from LPCs, but also supervision from a clinical psychologist. And I will say that the styles were very different, you know, and there were things that I was able to gain from and things that I could, you know, look back and say, you know what, I'd rather leave that behind because I didn't think that that was too of a positive experience. But I say all this to basically mention that the way we have been supervised in the past certainly has a strong influence in regards to the way we may provide supervision to others in the future as well. We may specifically say, you know what, we want to hold on to those negative supervisory experiences and make sure that we treat our supervisees perhaps differently than we have been treated, specifically if there might have been some criticism or perhaps even some hurt or some pain that's been experienced. But then also on the flip side, if we've had positive experiences, we certainly hold on to those as well and say, you know what, this has really helped me as a beginning counselor. And I would want to make sure that the students that I supervise in their experience receive the same valuable treatment as well. I think it's good to remain in tune with one's own biases in regards to supervision experiences, specifically the negative ones that we may still carry with us, but then also hold on to the positive ones as well. But let that experience, you know, don't necessarily influence negatively the way we provide supervision to others. So all this to say, we have to remain in tune of that and use that as a thread too, as we provide supervision services to others. Why is training and supervision necessary? I think we have to start this conversation by identifying that supervision and counseling are two separate entities specifically. Supervising without training gives the message that any good counselor essentially could also be a good supervisor. Okay, I don't necessarily disagree with that particular statement. I think good counselors certainly are equipped to also be good supervisors, but we have to identify that the practice and theories applied within counselor supervision is a little bit different than just regular counseling as we know it. Without training, most supervisors model the supervision that they have received, good or bad, as already alluded to, so to a certain degree. Supervision skills we have to recognize are similar, but not necessarily identical to counseling skills. Supervision training provides the supervisor with the necessary skills that effectively train and evaluate the counseling student supervisee. I would like to underline the word evaluate here for just a second, because we find ourselves within the seat of evaluating competency, their efficacy within counseling development, and we want to be equipped to provide our supervisees with constructive and good feedback to basically enhance their growth as beginning clinicians as well. Supervision is correlated with enhancing the professional development of counselors, I think is important to mention. And counseling supervision comprises the conceptual understanding of skills related to all aspects of the counseling process as well. And then last but not least, we also have to identify that it is really our ethical responsibility, okay, to work with individuals, to provide individuals with constructive feedback, to recognize that just counseling and supervision specifically are two separate entities that follow their own models of practice as well. So what is counselor supervision specifically? I'm going to draw from various definitions here this morning to underline some of the definitions of supervision specifically, but the Council of Accreditation of Counseling and Related Educational Programs, CACREP, which is basically the main accrediting body for counselor education programs here in the United States, defines counselor supervision as a form of instruction whereby a supervisor monitors and evaluates an internship or practicum student's performance and quality of service provided, facilitating associated learning and skill development experiences. It is not counseling, as already mentioned, not case conferencing or case consultation, although it may include these aspects to a certain degree, depending on which supervision model a supervisor might utilize. But again, it has its own models, techniques, and its own interventions that it may use. And the purpose is not the same as the purpose of counseling. Specifically, drawing from the Association of Counselor Education and Supervision that recognizes the need for both administrative and clinical supervision of counselors to encourage reflective practices and continuous growth that results in increased competency and self-efficacy specifically. Again, those are two terms that I would like to highlight here a little bit: increased competency and self-efficacy within counselor training and counselor development. We basically have to recognize that when students enter something like a Master of Arts in Clinical Mental Health Counseling program, that they may come into this profession with zero professional background within areas of counseling or psychological practices. It's not necessarily a academic prerequisite for someone to already host, to have, let's say, a bachelor's degree in social work, or perhaps even in counseling or psychology specifically. So when we then prepare students from a theoretical perspective to enter practicum and internship field experiences, we basically send them in with the understanding that there's very little competency, specifically from a practical perspective. You might have read the textbooks, they've completed the assignments, but from a practical perspective, there's very little competency in that respect. So we want to utilize practicum and internship experiences to grow competency in particular areas, and also encourage and strengthen their self-efficacy as well in regards to how competent they view themselves within the seat of the counselor. Administrative supervision varies by setting and includes activities and interactions that impact the quality of counseling or clinical services delivered. And clinical supervision involves the activities and interactions designed to improve clinical knowledge and skills related to the application of counseling theory as well as techniques. When it comes to the Association of Counselor Education and Supervision best practices for clinical supervision, I would like to draw you to the link provided below. Jessica, I don't know if everybody will be receiving a copy of the presentation as well. If not, then we'd be more than happy to send out this link for your resources also. But the ACES best practices for counselor supervision delineates 12 core areas of knowledge, competencies, and personal traits that characterize effective supervisors. Okay, I've just summarized the ACES best practices for clinical supervision here. And as you can see, such is quite comprehensive. Okay, best practices basically are broken down into areas of initiating supervision, goal setting, giving feedback, conducting supervision in itself, the supervisory relationship you may have with your supervisee, diversity and advocacy considerations, ethical considerations, documentation of supervision, evaluation of supervision, the supervision format, the supervisor and it's in his or her role specifically, and then supervisor preparation as well. As you look at this comprehensive list, that's already an indicator that, yes, supervision is a little bit different than just traditional counseling specifically. Although we see some parallels in regards to initiating a supervision session specifically, goal setting is something that we're certainly familiar with in regards to the work that we do with counseling clients, giving feedback, for example, diversity, advocacy, the relationship in itself that we may have with our clients, documentation, ethical considerations, and so forth and so on. There's a very strong parallel process that occurs. However, again, we want to recognize that supervision practices, best practices specifically, are different than counseling best practices and basically reside on their own individual platform, okay? When we look at this very comprehensive list here as well, we need to recognize that supervision or providing supervision is not just a simple task. It is quite a comprehensive undertaking, and we're certainly aware of the responsibilities that you have taken on as a practicum or internship supervisor for our students, but it's not an easy task. Okay, so we want to make sure that you are equipped, hopefully with some helpful information. A particular component that I'd like to draw out as well would be culturally competent supervision or culturally competent supervisors specifically. As we live within a very diverse world, we live in a diverse culture, where specifically cultural and racial differences, first and foremost, do need to be acknowledged. Okay, we are different from one another, so we value the differences within one another, but we also have to understand how these differences that we experience on a regular basis, whether it's with clients or with our supervisees, do have an impact on the supervisory relationship and the work that we do with our students. Culturally competent supervisors understand that culture impacts the dynamics of the supervisory relationship. The counselor supervisor is responsible for addressing cultural issues as they may arise, necessitating cultural sensitivity, cultural competence, and self-awareness as it relates to one's own cultural values as well as assumptions. Counselors and counselor supervisors do not make value judgments or allow biases to impact their work with clients and supervisees, which comes straight out of the ACA Code of Ethics. Potential counselor supervisors also need to review the ACA ethics codes with particular attention to sections A, E, and F, particularly as they specifically relate to cultural competence from an ethical perspective. Culturally competent supervisors also are well-versed in the variety of techniques and strategies that address oppression and enhance psychological freedom specifically. And we also found within the ACA Code of Ethics that there is a lack of cultural competence in counselor supervision, which may be considered to be a violation of the ACA ethics codes. which states counseling supervisors are aware of and address the role of multiculturalism/diversity in the supervisory relationship. Okay, so we want to acknowledge that we need to remain ethical within the addressing of cultural differences related to diversity, race, cultural differences, language sometimes, and everything that makes us unique as individuals as we work with supervisees. Okay. Some pieces on ethical and legal considerations within counselor supervision. Okay. We certainly know that the ACA Ethics Code specifically is quite comprehensive, okay? And as individuals who on a regular basis, are active in clinical practice, it is my understanding, or my assumption, I should say, that everybody is familiar with the ACA Ethics Code. But again, although supervision is separate from counseling, there's things that we can draw from the ethics code to also inform the work that we do within supervision practices. Ethical and legal considerations in counselor supervision require clinical supervisors to have gone or to have a thorough knowledge of professional ethical codes and legislation that governs the practice of counseling. Supervisors should be knowledgeable of ACE's ethical guidelines and counseling supervisors in the ACA Ethics Code with particular attention to Section F, as already mentioned. Supervisors are ultimately responsible for the welfare of clients, thus responsible for assessing the supervisee in working through difficult issues encountering during counseling sessions and supervision specifically. So as a supervisee is working with another client, it becomes our responsibility as well that that client essentially receives best practices from a clinical perspective. Okay, so it's not just the student's client, it also automatically becomes our client to a certain degree as well, as we provide supervision and guidance to those working with the client. When it comes to ethical and legal considerations in counselor supervision, we have to pay attention to these areas that we may always model ethical practices, as certainly our supervisees' eyes are constantly upon us. Okay, I don't know about you, but when I found myself within my graduate training, I would constantly observe, the interactions, the actions, the decisions, and things that my supervisor or supervisors have made in regards to the treating of clients from a professional perspective. And from my perspective, at least my brain always told me, if they're doing it, then of course, it is okay for me to do it as well. But then at times I've had to, look deeper in regards to, well, what is right or wrong from an ethical perspective, and sometimes come to the conclusion that that's not quite ethical, and I think I may have to disagree with these decisions of ethical practices. Which then even required me to go take a step back and say, well, let me run this by my faculty supervisor because I don't quite agree, with what's going on here. So just be mindful that, students are watching you from all angles sometimes and will apply what they see as you model ethical practices. Supervisors also need to clearly communicate expectations. Okay, they monitor supervisee and client interactions on a consistent basis. Supervisors ensure appropriate documentation, as well as assess client progress and supervisee performance. Okay, all that plays from a practical perspective into the legal and ethical considerations within counselor supervision. So it's not as simple as basically saying, okay, I'm going to devote an hour a week to basically sitting with my supervisee. We'll talk about some cases and some clinical information, and then we'll be on our merry way. It's a little bit more complicated than that. Okay, we need to know that students' eyes are watching us. We have to communicate effectively. We have to monitor supervisee and client interaction specifically to make sure that the case is handled appropriately. We have to appropriately document and sometimes assist our supervisees within their documentation practices as well, but then also for us to document the supervision that we provide to our students, as well as evaluating and assessing performance as well. And I know Jessica is very diligent in regards to making sure that any kinds of evaluations and assessments that need to be filled out by US site supervisors are communicated effectively. Okay, let's talk a bit about having an effective supervisor and supervisee relationship. Again, the supervisor-supervisee relationship is different than a traditional counseling relationship. Although, again, we could spend some time on drawing parallels in regards to the client-counselor relationship, because there certainly are certain parallels, but the supervisor-supervisee relationship is a little bit different. The supervision relationship begins with essentially a contract review, collaborative goal setting in regards to what might it be that you would like to gain from your supervision experience, clearly communicated expectations and processes of how supervision will take place, theoretical orientation for supervision, which we'll talk about here in just a little bit, and emergency procedures, as well as methods for both formative as well as summative evaluations that can be either in written form or in oral form as well. Formative evaluations are those assessments of supervisee progress that take place throughout supervision in the form of a planned and ongoing feedback loop, essentially. And summative evaluations are those assessments that are planned and conducted at the close of a specific time period established in the initial supervisor and supervisee meeting, typically at midterm as well as at the end of a practicum or internship semester, is when you will be asked to complete summative evaluations of our students, where that feedback then should also be shared with our students in that respect as well. But then the ongoing formative feedback is something that should take place on a consistent basis as you provide either individual or group supervision to your supervisees. Effective counselor supervisors also address variables that arise and impact the supervisory relationship, also provide continuous feedback, as already mentioned, and monitors progress towards goals as well. I believe goal setting is very important within the supervision practice or the supervisory relationship, because it always provides you, similar to a client and counselor type relationship, the ability to go back to your one's treatment plan and say, okay, how have we met certain goals that we set at the very beginning of our relationship? Okay, so similar to the supervision practice, we can go back and say, okay, what progress have you made in regards to meeting the goal that you have set at the very beginning of the semester, for example, and utilize such as a platform for continued growth. And then also termination is something that is part of the process as well, part of the relationship. At some point, there will become a time to say goodbye as students essentially move on from their practicum and internship experiences. Termination of the supervisor-supervisee relationship includes summarizing the process and providing feedback on goal attainment, strengths, and areas of growth, as well as areas needed for further development, encouragement that you may want to pass on to students to say, hey, I would encourage you to continue to grow in certain areas as you move on into your professional practices. With all that in mind, within effective supervisor-supervisee relationships, there may also be some complications and some concerns that you may identify as well. It may not always be a quote-unquote, beautiful process. There may be complications that you may come across in regards to students' interactions with clients, clients' concerns, difficult cases, interpersonal problems that may arise within students that they may then also bring into the counseling office, and so forth and so on. It's not always an easy process to kind of mediate and delegate some of those complications. We have to recognize that the process of supervision is a complicated one with multiple elements involved, as well as people involved also. Supervisors are faced with a threefold responsibility in regards to protecting the welfare of the client, as mentioned, monitoring supervisees, as mentioned, and their professional development on top of that, as well as protecting the interest of the profession and public at large. Gatekeeping might be a term that you're already familiar with that certainly resonates with this particular sentence here. Counseling supervisors take on multiple roles when they become involved in the supervision process, and which can be those of a supervisor, an educator, a mentor, an evaluator, but then also a role model for the counseling profession. Again, not as simple, as just providing, a simple hour of supervision. I'd like to draw your attention to 9 particular areas, specifically identified by Tannenbaum and Berman, who recommended 9 areas for supervisors to continually monitor in their work with supervisees. These areas are: supervise only areas of expertise. Okay, that probably rings a bell in some of you. As we also say, within the regular counseling world, we should only practice, within our areas of expertise. As mentioned earlier, I would say my area of expertise is addiction treatment. I'm not really good at counseling couples. So couples are typically not allowed in my office unless there's an addiction problem that's going on. But similar to such, supervisees should only be receiving supervision from individuals in a particular area of expertise and practice that they're familiar with. Choose a specific supervisory model that you may like to utilize to basically provide a theoretical thread as you provide supervision services to your supervisee. And we'll talk about some of these models here in a second. Avoiding dual relationships, okay? Your supervisee is your supervisee, okay? Not your friend, essentially, that at the end of a long clinical day, you say, all right, let's go out to dinner, okay? Or let's meet on the weekends and go on a nice hike because the weather is going to be great, okay? It's really important to keep those relational boundaries active as you're providing supervisory services. Regularly evaluate the supervisee's competence, sometimes utilizing various different assessment tools that we may provide you with as well that can support that process. Number 5, being available for supervision. Okay, it's not going to help the supervisee within their professional growth if you, as a supervisor, you're always busy. Okay, and you don't have time to provide either individual or group supervision to the supervisees that you have taken under your wing. So you have to make yourself available, whether that's through setting specific times during the week or having a certain time period where an open door policy may be appropriate, so that your supervisee knows that, hey, I can come to my supervisor for questions that I may have. Formulating a sound supervisory contract, okay, that basically outlines the process and regulations of the supervision that you are to provide. Be aware of any kinds of financial considerations within supervision. That does not necessarily speak to the aspects of counselor trainee supervision, but if you may also provide supervision services outside the scope of practicum and internship students, there are financial considerations that may need to be taken into consideration. Maintaining professional liability coverage, as well as supervising honestly and with integrity. Tannenbaum and Berman strongly advocate for these 9 areas to be monitored on a regular basis to kind of provide a foundation of, or basically a way to check the box of basically saying, if I do these things appropriately, then the supervision that I can provide to others may be covered from a best practices perspective. Okay, let's now begin to transition a little bit into different supervision styles as well as models of supervision. And again, I don't know where everybody comes from in regards to previous training and experiences in supervision. You may already have an identified model that you use within your supervision practices. So perhaps this may just be a little bit of a refresher for you as well. When it comes to the counselor supervisory style, it is defined as strategies applied by a counselor supervisor, which are selected based the supervisee's developmental level and specific client in a given context and impact the supervisee's perceived self-efficacy and the supervisory relationship. And for this reason, supervisors are encouraged to adopt a variety of supervisory styles in order to customize supervision to meet the needs of diverse supervisees as clients served. Um, from that perspective, we may say that an integrative approach to counselor supervision may be something that one may want to develop. I would say from my own personal supervision that I may provide to others, I consider an integrative approach to supervision kind of my theoretical thread to supervision, as I may say, you know what, to certain supervisees, a solution-focused approach may be something that's needed. Others may benefit more so from a developmental or a discrimination type of approach to supervision. It really depends. As I may also say, one theoretical approach does not necessarily apply to every client that is going to walk into my office. Yes, I may have to have a theoretical home and a base that I find myself very well versed in, but sometimes, you know, it's good to draw from other methods and techniques as well to support the needs of a supervisee as well. When it comes to models of supervision, as already mentioned, a variety of counseling theories are used as frameworks for counselor supervision, and commonly used models of supervision are a client-centered approach to supervision, a solution-focused approach to supervision, a behavioral approach to supervision, a developmental approach to supervision, as well as a discrimination model of supervision specifically. I'm going to dive into every model just from a introductory perspective to refresh our minds a little bit in regards to what these models might look like. The client-centered model specifically is very closely related to what we find within client-centered approaches within the counseling approach as well. This model of supervision is grounded within the work of Carl Rogers. As we know, he is the father of client-centered therapy specifically, and relies heavily on the therapeutic relationship. We would say, in this case of supervision, the counselor supervisor centers the client's supervisee's world to promote change, believing that the supervisee has the ability to engage and bring out growth. The supervisee uses major tenets of person-centered counseling, such as unconditional positive regard, specifically active listening, clarification, and summarizing to promote supervisee reflection and processing. I would say the client-centered model probably is something that a lot of you may already naturally use in your regular ongoing interactions with your supervisees as you actively listen to what your supervisee is sharing with you. Unconditional positive regard, acceptance, basically providing a positive environment and atmosphere for the supervisee to grow and flourish within the time that you spend with them. But similar to Carl Rogers, just a very positive and warm approach to the supervision that you may provide. On the other hand, solution-focused supervision is very different, you know, than client-centered models of supervision. Again, similar, a lot of parallels to the counseling process as well, but solution-focused supervision is grounded in a research-based counseling theory and has been found to be particularly useful for site supervisors in schools and other settings where there is limited time for supervision and limited clinical supervision training sometimes. Certainly places that are very fast-paced, thinking of either residential or inpatient treatment settings where there's just a lot of movement, large population, a lot of staff that moves in and out, to where time for appropriate supervision may be limited in regards to other factors that need to be considered in the supervision environment. But the emphasis is more on a collegial supervisory relationship. Much like solution-focused counseling, the supervisor uses techniques such as video talk, scaling, and the miracle question sometimes to identify, conceptualize, and promote the growth of counselors in training. The focus is, as the name says, you know, the solution that we want to get to within the supervisory interaction. and promoting change from that perspective. Another model, not as frequently or not as often applied, I should say, is the behavioral model of supervision, which is grounded in the principles of learned behavior specifically. The supervisor works with the supervisee to identify targeted goals as well as a plan to meet those goals. And the supervisor then strictly uses modeling and cognitive rehearsal to promote learning, thus change and growth in respect. The developmental model, very popular typically as well within supervision practices, focuses on supervisee changes over time within the training and clinical experience, assuming that the supervisee moves through stages that require differing levels of supervision. The counselor modifies the sometimes intensity as well as nature of supervision based on supervisee growth, and may take on the role of a teacher, sometimes a consultant, the counselor throughout the process of supervision. The trainee then moves from a place of dependency with limited skill and awareness to increasing autonomy, awareness, as well as skill. From the perspective of counselor competency development and increasing counselor self-efficacy, this is particularly a model that certainly applies to those practices, because we want our supervisees to grow. Again, when they first come in, when they're young and inexperienced as practicum students, we want to move them from a place of I'm very dependent on my supervisor in regards to what they're able to offer me, to a place of I would like to gain autonomy and stand on my own feet when it comes to my work with my clients. And developmental models of supervision certainly enhance the growth of students from that perspective. Supervisors also match training interventions with the supervisee's level of development then as well. So interventions that may be utilized in supervision practices are then also, from this model's perspective, tailored to the developmental needs that students may have. And then last but not least, I'd like to highlight the discrimination model that also tends to be fairly popular within supervision experiences. Bernard's discrimination model originally hit the surface, I should say, in 1979, has become the most used and researched model in counselor education specifically. Originally, this particular model was developed to teach doctoral students how to provide supervision to master's level counseling students and to reduce supervision to its core tasks, to show how supervisors need to act and what needs to be focused on as well. The supervisor here basically takes one of three basic roles in a supervision session. It is the role of a teacher, the role of a counselor, as well as the role of a consultant. The four foci of supervision and counseling performance skills, cognitive counseling skills, self-awareness, and professional behaviors specifically. This may be very familiar to some of you who are familiar with the counselor competency scale specifically, that we use to evaluate our students, specifically self-awareness, professional behaviors, as well as increased cognitive counseling skill development is part of that growth process. This model is sufficiently complex to cover key areas of supervision, allowing supervisors to choose from a variety of roles, functions, and foci depending on needs, motivation, skill level, and person of the supervisee specifically. When it comes to breaking down all the different roles, when we look at the supervisory role as a teacher highlighted within the discrimination model, some of the responsibilities that fall under the teacher role of a supervisor are the following: evaluating observed counseling sessions and interactions, identifying appropriate interventions, teaching, demonstrating, and then also modeling intervention techniques specifically, explaining the rationale behind specific strategies as well as interventions and providing supervisees with the necessary education to then also go and apply certain interventions and specific strategies that were taught, and to interpret significant events within counseling sessions as well, specifically when the supervisee comes in and says, you know what, I've experienced some difficulties here. Can you help me understand, what the client displayed here? For example, we want to help interpret some of those struggles that supervisees might experience, and utilizing a teaching role to educate them on some of that. When it comes to the supervisory role as a counselor, again, we have to be a little bit careful here to basically not fall into clinical modes of basically saying, well, I'm going to treat you as my client here for the next 10 minutes. The supervisory role of a counselor is a little bit different here. We want to explore supervisees' feelings during counseling sessions and the supervision session as well, to essentially help the student gain basically some self-awareness in regards to what's going on within themselves as they find themselves working with other clients. Exploring trainees' feelings concerning specific techniques or interventions that they may become familiar with, looking at perhaps some discomfort that they may have in executing some of those techniques and interventions. Facilitating supervisees' self-exploration of confidence and or particular worries that they may have within the session as well. I would say something that comes to my mind at first is, particularly at the beginning of practicum and internship experience, when it becomes time to spend an entire session, with, their own client, there's typically some anxiety and some nervousness that goes along with that. Utilizing time within supervision to give the supervisee the opportunity to explore some of that anxiety or nervousness can be very effective to basically identify, well, what else is going on underneath there, so we can look at how can we move beyond that initial anxiety that you may experience as you're working with clients. Also, we want to help trainees define personal competencies in areas of growth, as we already talked about earlier, and provide opportunities for trainees to process their own affect or defenses as well. And then we also have the supervisor role as the consultant. Okay, that is different than the teacher and the counselor from the discrimination model's perspective. The consultant would say that we need to provide alternative interventions and or conceptualizations for the trainee to use, specifically as they find themselves engaging or finding themselves confronted with roadblocks, not knowing what else to do with a particular client, struggling identifying certain treatment objectives or interventions with their clients. We want to encourage supervisee brainstorming of strategies and interventions, encourage trainee discussions of client problems, motivations, etc. Solicit and attempt to satisfy trainee needs during the session, and also allow the trainees to structure the supervision session to a certain degree, basically being able to verbalize how they would like to spend the time in supervision for their own growth perspective. As we would say, yes, the discrimination model may be the quote-unquote most popular model to apply as we're looking at the supervisor role of consultant, teacher, as well as counselor. I think it's also important to highlight that there's some additional supervisory roles that we may find ourselves engaging in at multiple times in the supervisory relationship that may not necessarily be just solely supported by a particular theoretical approach to supervision. We would look at the supervisor as a sounding board, essentially, basically as supervisors providing safe places for our students to come to, being able to verbalize and discuss ideas, being able to provide objective feedback, talking out loud sometimes to clarify thinking and solidify decision-making processes, discussing fears, hopes, and frustrations with work and or training. We may also look at the supervisor as an advisor specifically, giving advice in regards to specifically duties to warn, ethical practices, what do we do with clients who may present suicidal court appearances, maintaining reporting, etc., and providing guidance from those perspectives. Immediate action is necessary to provide safety for clients or others. There may not be time for supervisees to learn, process, and make an informed clinical decision, where we need to step in and say, let me take over as an advisor, to basically protect the welfare of the individual if needed. And then last but not least, we're also looking at the supervisor as an administrator. Again, when it comes to the modeling of attending to policies and procedures, we want to model the dealing with legal and ethical matters, specifically in regards to documentation. We want to help the supervisee learn about bureaucracies, assuring adherence to licensure regulations once it becomes a licensure issue, and reviewing supervisees' legal requirements involved in reporting, and then adhering to areas of violence and suspected abuse as well. And then I would say the last factor that needs to be considered, which again is a term that I'd like to highlight a little bit, is the supervisor as an evaluator as well as a gatekeeper specifically. As gatekeepers, as supervisors, we have the ethical responsibility to protect the counseling profession as well, and make sure that our students very much are capable and able to provide the services that we basically entrust them with. That comes along with the evaluation, which is a primary responsibility, providing regular and systemic feedback and evaluation to students, providing information to licensing boards, professional associations, universities, graduate programs, prospective employers, and so forth, as well as providing information and character references, sometimes background checks when required, to agencies or licensing boards as well. So in summary, essentially, as we look at various different models of supervision, we're looking at various different roles that you find yourself in as the supervisor to students. It's not as easy to say, I'm just going to sit down and listen, to the struggles that my supervisee may have. I'm going to give them some techniques and some skills to use and send them on their merry way. It's actually a little bit more complicated. And I would like to open up the floor a little bit in regards to some questions or comments that you may have in regards to perhaps some struggles that you've experienced in regards to applying supervisory models, various different roles that you have found yourself engaging in with students, or perhaps even some ethical difficulties that you've encountered in the works of a supervisor. If you don't have any questions or comments, that's absolutely okay as well. We certainly appreciate your time and your attendance.
Great. Okay, well, if there's no questions, we can wrap it up, and I will be sending out you guys a certificate of attendance and a recording of this presentation later this week as well. So thank you guys for attending.
Absolutely. Thank you so much for your time. Again, we appreciate all the work and the effort that you are investing into our students on a weekly basis, sometimes a daily basis. I hope that this brief review of supervisory practices and topics that I've covered in this brief presentation have been helpful to you. Also, please feel free to reach out to me directly, as you may find my contact information on the CCU website should you have any additional questions or concerns.